video right now. It has been forever, and I keep wanting to do a new video, and then I always like chicken out because I worry too much, I guess. And my mental health necessarily hasn't been, or life isn't necessarily how I thought it would be. I'm making it sound exactly like what I'm talking about, like negative outlook. Like I don't want to bring that vibe to y'all, but it's kind of the vibe I've got lately. My brain fully developed at 26, 27, whatever they say. Actually, I heard there might be new research saying it's not until later in life, but whatever, we won't get into that. But my brain developed, and my God, did I get a pessimistic and nihilistic outlook on life. And I really saw the world for what it is, which is not a pretty sight. Human beings specifically. Anyway, not what we're getting into today. I just wanted to say hi. I was just watching some ASMR while doing some research, and shout out Jones ASMR. Focus. Sorry. He said in a video that I was watching, thank you, that somebody said, like, I think somebody asked him a question about, like, why did you start making ASMR videos, or like, what are you gonna make or something? But he responded just now and said, I don't really think about, or I don't worry about what I'm making. Like, I'm just making it because it's fun. And I remember that that's what I started off, or that's why, or what I started doing ASMR for. Like, it's fun and relaxing, and it was helping me sleep, and I wanted to like give back and make a community and all that good stuff. So it reminded me of like the core principles of why I first started doing ASMR, and I was like, you know what, come on now, just make a video, dude. So here we are. It's been a long, wild ride, my God, and here we are. And yeah, I don't have much to say. I don't have much to update you on. I have 2 cats. I am living in a different apartment, I believe, than my last video. I don't even remember the last video I uploaded. I am single. I am a full-time PA working in primary care. The shat-on specialty of Western medicine. I love what I do. I love medicine. Truly don't think that there's anything else in this world that I'm that passionate about. Just hate the system that I'm working in. Capitalistic Western medicine right now is ugly. Insurances are ugly. Businesses are ugly. Money, everybody's so money hungry, and I just like, that's not what I feel in my soul, so it's hard. I'm balancing a lot of cognitive dissonance between what I feel is right and what is actually reality. I'm also going to apologize in advance if they're noisy. I'm sorry, and these are one of the reasons why I don't want to make videos, because I'm like, I don't want to cut it out. But you know what? I'm just going to let it be fully raw, baby. Okay, so what was I saying? Nothing important, clearly. The dissonance between what I feel and what is reality is tough. It's real tough, y'all. I just want the world to be a better place, and it is not. There's some ugly people out there. There's some shitty people. And, yeah, that's pretty much that on that. me, the medical field out there is scary, y'all. It is scary. There's some bad medicine being practiced by a lot of specialists and physicians out there. Girl, what is going on? I know what's going on. Everybody's overworked, and people want to. Now, I'm about to get controversial here. Hot take. I think. Now, I said I think. This is my opinion. That to be the best provider, one has to dedicate a lot of their free time to staying up on literature, research guidelines, and if you have a full life with a spouse and children and all that stuff, I think that's hard to do. I'm sure there are people out there that do it. I clearly have absolutely zero data to back this up, other than I try to think why there's so many. I'm trying to give an excuse for why so many medical providers are not up to date all the time, or are not even trying to stay up to date. I think there's also a lot of laziness out there. I don't know if this is like a new thing or just like people are just lazy or what. But like I want to say there's a component of OCD. My self-diagnosed OCD doesn't allow me to not give a fuck. Like, I care too much, some say. And in my review this year, which I just got at the beginning of this month, it did say I am a perfectionist to fault at times, and that I need to lower my standards a little bit. And wouldn't a lot of people say that across my life? And why I'm still single. Okay. Anyway, what else? Let's switch the subject. Okay, let's talk about other things going on in my life, because I don't want it to just be work. Oh, but anyways, yeah, so I'm still working same place that I started at when I graduated. I've got my full patient panel. My patients love me. Like, it's so funny. If I could go back in time to PA school, Griffin, when I was struggling, I was on the struggle bus. Y'all were there. If you were a dedicated sister. I was struggling, mama. I had to get on antidepressants. It was a whole thing. You guys were there for it. Come on. And I seriously, there were times where I was like, this is not for me. I'm not meant to do this. Babes, when I tell you, my patients are so nice to me. Not all of them, actually. Well, I don't know the data on that either, so I'm not going to try to make generalizations, but a lot of patients really like me and say nice things to me and say that, I'm the best, and sure, does it inflate my ego a little bit? Absolutely. But I love it. Like, it feeds into something. Oh my god. Anyway, so, yeah, so, like, there is a part of me where I was struggling in school and, like, had so many, like, professors a slumlord's looking to make money. Why is that shocking? I don't know. But it is the case. And I don't know if I think my next move might be in a year to buy a house or like move into a house, which is crazy. And I don't want to deal with all the upkeep. And like, I really feel I want to move into a house with a partner to help me, because that is definitely the area of my life that I lack. My apartment is not the cleanest in the world. I'm getting better. I'm trying. But my apartment is not the cleanest in the world, and I'm very good at procrastinating that stuff because like it's just for me, and like who cares? But I don't want to bring that to somebody else. So I feel if I had somebody else there that I felt I like had to answer to, like when my mom comes over, I clean the apartment, because like once I have something to live for, baby, I live. Totally switching subjects. My favorite, we're gonna do a little up close whispering. My favorite new YouTube channel is Smash. And I feel like I've gone through many different eras of YouTube, like groups that I'm obsessed with. For example, there was a period of time where I was really into the H3 podcast, and that was after Trisha Paytas kind of introduced me. And that was a different point in my life, obviously. And I loved that podcast. And then when Trisha left, I still continued to watch the H3 podcast. And then, girl, when the Palestine stuff came out, girl, I did not like his views at all, so I stopped watching. And another podcast that I watched was The Morning Toast, or The Toast, I think it was called. And then I found then when the pandemic was ending, they made an episode where these girls who are gold spoon in their mouth from birth, their parents were like uber conservative, like spokespeople or rich. That's all I need to know. Rich. And they were telling people in the podcast that these people who are working from home, who refuse to go back to work, need to come back to work and do their job. And it's like, girls, I love you, but you're sitting there doing a podcast. Sisters, you should not be talking. People in glass houses should not be throwing rocks, honey. So that was kind of gave me a bad taste. And then I found out about their conservative family, and their views also on the Palestine and Israel thing. So I had to stop watching them too. And then there was a period of time where Bon Appetit was like the thing that I was obsessed with. They had an amazing YouTube channel. They had amazing posts all the time. And then it came out that their editor, did blackface, and also they weren't paying the employees of color the same as the white employees. And like, not only would I have stopped watching, but the literal thing entirely fizzled out. Like, these were like my safe spaces. Like, they were safe for me, like, to get away from all the craziness. And then it comes out that they're like just as bad. So my latest is Smash, and so far, so good. Like, I'm really, because they post a lot of content too. Like, they feed you so well. Like, not only is it so good, but mama, they feed you. And I just love all the cast members, and like, there's just so much lore to it, and it's just something that I go, and it's like sketch comedy / improv. Like, it's just fun, and they're trying to have fun. But like, sometimes, especially when I'm high, I start like seeing behind it, and I'm like, is this all an act? No. And then I gotta like try to stop like looking into it, like just enjoy enjoy it. Just enjoy it. Why are you doing that? But yeah, that's my latest obsession is the YouTube channel Smash. I feel like I'm still 16 and obsessed with the YouTube channel. And of course they've got like 4 different channels: Smash Games, Smash Pit, Smash Main Channel. Ooh, and then the new side channel that it was Anthony's channel that now, I don't remember what that one's called. I think that's something like online. So anyway, so there's that. What else can we talk about? I'm gonna have to go back to medicine because I don't have a personality otherwise. Well, video games, I'm still playing video games, obsessed with video games. Like, that is still one of my favorite things to, like, relax with. I, play all different types of games. I actually just found out yesterday that my favorite video game, I wouldn't say of all time, but, like, of recent years, like, I would say of, like, the 2020s, I guess. I don't know how far back, because, like, if I look back on, like, all the video games I've ever played, like Sly Cooper, if you guys ever played Sly Cooper on PlayStation, like, that holds a special place in my heart. Like, there's so much nostalgia to that, and that, like, was one of my favorite games ever. Anyway, so I think that would be number 1. So this might be number 2 of favorite video games ever, but definitely number 1 of the past couple of years is Control, it's called. It's like about a paranormal, like FBI, and we are not doing this right now. It was like a paranormal FBI, and like, the character takes over as like the director of the FBI, and like you go explore, and you have like a shape-shifting gun, and it was really cool, like kind of magic-y telekinesis. Like, it hit every spot, and like the visuals were beautiful, and it had like good storyline, and yeah, so obsessed. And literally have been, like, I think about the game all the time, and I did try to download it recently to play it again, but I was like, it's just not hitting the same, so I didn't play it anymore. But I just found out last night that they're coming out with a, what's the word, not a prologue, they're coming out with a sequel video game called Control Revenant or Resonant or something like that. I found it yesterday. I was so emotional. Like, I was like kind of being dramatic, but at the same time, like, was so excited. Anyway, so that's exciting. Have been playing Satisfactory. It's like a factory building game. Mind-numbing. I love it. Speaking, oh my god, wait, before the end of the night, I have to finish my Homescapes is this video game, or this phone game that I play. I just like mind-numbing stuff when I'm not doing work. So yeah, Satisfactory, and I just downloaded Schedule 1, which is like a fake drug dealing game. That's fun. And it's like weed, but they want me to start selling meth, and I'm like, no, I don't feel comfortable with that. Like, I'm fine with the cannabis, but like the fact that you want me to sell meth, I'm not into that. Like, you got the wrong girly. So I'm gonna see if I can continue getting away with just cannabis, but I'm nervous. Anyway, what else? Favorite music. I mean, there's so many favorite music artists. So all my favorites, I'm just telling you about me. Favorite music. I don't know. Anyway, well, I would say I think it's album of the year for me is the newest album by a group called Melt. Olivia Dean's newest album. I really want to do album reviews or music reviews for the past couple of years, because like I used to do those and I haven't done one in a while, and I love music still. But anyway, I still haven't seen Wicked for Good. I cried so hard during Wicked Part 1. I'm so Jesuit off series from Dune, which I'm forgetting the name of it, but that's coming to HBO, another season of that. So is something else, two other shows I think that I watch on HBO that I'm excited to see new seasons of. So sad the Wheel of Time got canceled. Heartbreaking, babes, heartbreaking. What else? I'm not sure what else. And then favorite like medical like topics / diagnoses. Like I would say that my top 5 are fatty liver / fibrosis. Obsessed with non-invasive testing. And the treatments like Rezdiffra and Wegovy and the GLPs. Obsessed. Anyway, I digress. Fatty liver, chronic kidney disease. Love chronic kidney disease. Love the monitoring. Love the secondary complications. Love hyperparathyroidism and the fact that we don't really know what an optimal parathyroid hormone level is, and yet I'm seeing so many of my providers out in the nephrology world starting patients on Cinecalcet and other drugs that haven't necessarily showed any benefit for the patients that they're prescribing them to in the research. But yeah, again, new update that I don't think we are up to date on. Anyway, okay, so yeah, chronic kidney disease and the monitoring urine microalbumin. Love it. Next, really into asymptomatic bacteriuria lately, okay? Women, especially as you're getting older, it's more common to have bacteria just found in your urine, like, and you're not nasty about it. It's just they're there, and they might actually be protective. But what happens is we're gonna keep treating this incorrectly, and then we're just exposing the world to antibiotic resistance, so that's not actually good, and there's no good clinical outcomes for treating asymptomatic bacteriuria, especially in the elderly, even if that elderly person is having non-genital urinary symptoms like altered mental status or a fall. Guidelines recommend against screening for bacteria in the urine in those situations unless they're having other symptoms like fevers, chills, and we cannot find another identifiable cause. about observational studies. Okay, I'm talking about randomized controlled trials. I'm talking about, yeah, I think pretty much that, meta-analyses, systematic reviews. Okay. There really is no data, from my understanding, as of right now, it is my opinion that there is no data linking low LDL to literally any negative outcome. I'm serious. In the newest studies looking at newest medications like Repatha, evolocumab, that can lower LDL so significantly in individuals, which we're finding beneficial for cardiovascular outcomes, we are not seeing an increased risk of complications, especially things like dementia. People are concerned about dementia. We see no signal of that. No signal as of 12/26/2025. Don't quote me on that, but quote me. I think I'm right. I'm pretty sure. I'm like confident. So yeah, so that in addition to like the really direct, pretty much causal relationship that we are 99.9% positive on between LDL and cardiovascular disease. People who think that their LDL in the 200s is not a concern really scare me. But I'm really mad at popular culture for demonizing the statins because I don't think they're that bad. I really don't. Anyway, moving on. B12. Oh, and going back, cholesterol. I just love like the goals, like the LDL hard goals of like less than 70 for secondary prevention, less than 55 if you're high risk, less than 40 in some new European guideline or Canadian guidelines. I think Canadian guidelines for the highest risk patients. And I love all the different medications. I love statins. I really do. I'm sorry. And I love Repatha. Those are my two favorite drugs. Ezetimibe, she's third. And then Nexletol bempedoic acid is number 4 for sure. I would lump all the PCSK9 inhibitors together at the top as of right now, because that's really only most of what I prescribe. I'm not prescribing any of like the newer, I don't even know some of them, like small molecule RNA or whatever the fuck the inclisiran is, I think. Anyway, Repatha, you get it. And then B12. Okay, guys, I've got bad news. Vitamins aren't all that they are made out to be. I'm like really sorry to say that. And if you wholeheartedly disagree with me, I recommend you get away from this video because you are not going to convince me otherwise. I'm so sorry. Like, I've read so much data. I just love reading about vitamins, and literally the more I read, the more I'm like, yeah, we don't know anything about anything. Classic. Let's talk vitamin D. I know I just said vitamin B12, but let's talk vitamin D, because I'm even more concrete on that. Guys, we don't know what a normal level of vitamin D is. We have good data. We have moderately good data where we can associate, we can hypothesize, we can extrapolate, we can educatedly surmise that corresponding 25 hydroxy vitamin D levels in the blood are associated with, reduced clinical outcomes. Specifically, the best data we have is for skeletal. That's it, guys. All of these non-skeletal recommendations for vitamin D, babe, no, we do not know what a normal 25 hydroxy vitamin D level is, and how do we even know that the body's utilizing it? Because that's not that's the best marker for like overall status, like what you've been exposed to, sun, ingestion, all that type of stuff. But like, we don't really know it. Like, how do we know your body's using it? There's different levels to blood tests, specifically biomarkers. Like, what is it? Is it telling us, are we terms of an outcome, are we talking about it as just like an overall, like this is just a measurement of like exposure? Like there's so much, like I can't even explain. There's so much nuance to labs. And so all we know is that, like, ideally, babes, you just want your 25 hydroxy vitamin D level more than 20. And that's probably like an over exaggeration for a majority of the population, because the individuals that came out with the recommendations for the recommended dietary allowances says that if your 25 hydroxy vitamin D levels above 20, that pretty much covers 97.5% of the population. So if everybody shoots for that goal, then we're all going to be, way above, or we're all going to be above what we need. 16 is really what like 50% of the population needs. So if you're anywhere between like 16 and 20, baby, you're most likely covered. You're like a 1 in 2 chance of that's enough vitamin D for you. Less than 16, mommy, you got to supplement. But we've got bitches who are doing high dose once weekly, once monthly, I think. Once weekly, 50,000 international units. No, mama. There's a concern of overdoing vitamin D. There's a concern. There's not strong data to back it up, but we're concerned. We're not sure of a toxic upper limit yet. Anyways, that's vitamin D. Back to B12. B12 is even worse, dude, because not only do we not have a good exposure marker, which you would think would be B12. B12 is a good exposure marker. B12 is just the exposure marker, a serum B12 level, because it corresponds to ingestion too. So you can't really say like, do I have good B12 levels? Because if you take a B12 supplement, your B12 levels are going to be high, but that doesn't actually mean that it's doing anything. So then we have functional markers, and for B12, the one most commonly used right now is methylmalonic acid, but it's not foolproof just looking at those two. You also need to look at folate, because folate deficiency and B12 deficiency are super interrelated. Homocysteine is another marker, but that's more non-specific. And then holotranscobalamin is the active form of, is the protein, is like maybe a better marker, but like you can't get that tested unless you're like in a research study. So like we shouldn't be okay. And then we go into like, well, why are we testing B12? Like the higher the pretest probability, the more likely that the test is going to be beneficial for you. If we're really unsure, like if you're coming to me and you're just like, hey, I just want my B12 level checked, mama, we're not doing it. We're not doing it. That's not how blood testing works. That's not how testing works. I am testing you for a reason, okay? And then we're basing it off of that. So like, for example, if I just did a stress test on the entire population, we'd have false positives, we'd have false negatives. If I'm sending a patient in for tight squeezing pressure like chest pain, that's worse with activity and better with rest, they are most likely going to have a positive stress test. And if they have a negative, we have a low threshold to say that that's probably a false negative, and we might move to an angiogram or something else. Like, it's based on going into it, the likelihood of it being positive. Like, we're really using it for like confirmation. So for B12, if we're just testing it for just shits and giggles, like we're not doing anything with that information. And at bare minimum, you should have your B12, methylmalonic acid, and B9 checked. That's what I typically do. And what you would want is like a low or borderline low B12. Hey, guess what? We don't even know what a fucking low or borderline low B12 is. Reference ranges are all over the place, and based on really old data that I looked into, it's crazy. It's crazy. We don't know what a normal B12 level is. And then methylmalonic acid, same kind of deal. You would use a combination of both of them, both being abnormal to truly be considered B12 deficient, in addition to them having symptoms. It's similar to IgE allergy testing. It's similar to like urinary testing, like we're talking about the asymptomatic bacteriuria. There's also another one, urea plasma. Let's get into it. There are two main species of urea plasma, which is a bacteria. app that I use, and Zotero, and I'd be like double checking, because if I'm talking about it and I know I'm not 1000% sure, why wouldn't I check? But anyway, I'm almost positive. Parvum, ureaplasma parvum, is commonly seen, and we do not think that it's pathogenic at all. We think it's a general microbiome flora. Like, we think it's normal and commensal and not bothersome. Ureaplasma hemolyticum is more likely to be pathogenic, but we need to see really high level, or we need to see high levels of it. I don't think there's any threshold definition for what high levels are, but we don't even have the methods of testing that. So like the currently available testing for ureaplasma, a lot of times it cannot differentiate between the species, so it automatically, we don't even know if it's the commensal or the potentially pathogenic one. And even if you are able to, they're just qualitative tests that say if it's detected or not. What we've seen is that a significant amount of the population of asymptomatic young men can have ureaplasma hemolyticum without any clinical consequence, symptoms, anything like that. So you really would need a quantitate the number instead of qualitatively say detected or not. Like, we need quantitative testing, and we see this across the board on so many different things. So, yeah. So we're seeing people get tested for these ureaplasma now, and it's actually recommended against by guidelines, including the European Urologic Association. So you guys look like fools, you doctors and PAs and NPs out there. Anyway, and also the Infectious Disease Society of America also recommends against it. Anyway, so yeah, so I'm fighting an uphill battle every day of my life, going against literally everyone around me. Oh, also, people with prosthetic joint replacements really don't need antibiotic prophylaxis prior to dental procedures. It's not recommended. It hasn't been recommended since, like, I think 2015 to 2016 or 17 when those guidelines came out. Like, what are we doing? Anyway, antibiotics are so dangerous, you guys. Like, just stay away from them. You don't want them unless you know that 1000% that a bacteria is killing you. Truly, that's how I feel. Anyway, I'm probably gonna go. Oh my god, it's been so fun chatting with you, and I think I need to do this more. And I got a new cord for my Blue Yeti, and I think that solved my entire video issues. Like, I'm so happy I got it's a micro USB